through what we have for you today. We have a lot to get through, so let's get into it. You are here today to learn more about the second draft of revised child care licensing standards for family child care. We are going to be recording this session, so please be aware of that. And we will be sharing that once made accessible on our project website for all of you. Next slide. So my name is Catherine D. Benedetto. I am a licensing policy analyst here at DHS, but more specifically, I work on the Family Child Care Regulation Modernization project, focusing on family child care. I am joined this afternoon by my colleagues Angela Urbanik and Brandon Tice. They are also licensing policy analysts here at DHS and work on the project as well. However, Brandon focuses on the child care center side of the project, and Angela helps us out with both sides of the project. Lastly, we are joined this afternoon by Daniel Trainter. He is part of the Minnesota Department of Health Indoor Air Unit, and he oversees the Radon. So he will talk to us a little bit more about what Radon is and the testing and mitigation of that. So you will hear from him a little bit later in the presentation. Next slide, please.
And Catherine, this is Brandon. Just an FYI, Daniel's having a little trouble joining, but I'm troubleshooting with him right now, so hopefully we'll get him in here in short order. But you can just keep going. I'll advance the slide here.
Okie dokie, sounds good. So we have, like I said, a packed agenda for all of you this afternoon. We're going to welcome you here. We're going to go over the supplemental materials that were shared along with the draft. Then we're going to jump into the significant changes that you can expect to see between the first draft and the second draft. Then, hopefully, technology willing, Daniel will talk to us about the radon testing and mitigation here in Minnesota and answer a few questions if able. And then we will talk next steps and engagement opportunities with this process of revised licensing standards. After all of that, we will have time to answer some questions as we are able. And we are going to be using the Q&A feature here. So if you go to, I think it should be on the bottom right-hand side of your screen, the Q&A button, feel free to pop your questions in there and we will do what we can to answer them. Next slide. So a little bit of housekeeping. Like I said, this is going to be recorded and then posted on our public website for those that are unable to attend the live info sessions. We'll be using the Q&A function. You are going to be muted and videos will be turned off, and that's for a few reasons. One, with so many people joining, sometimes the bandwidth can make things a little choppy if everyone's camera is on and muting and unmuting and all of that. And then secondly, because we are recording, we are hoping to keep things as simplified as possible for viewers that are going to be watching the recording. Also wanted to give you all a heads up that once we are done with everything in this info session, that you're going to be prompted to complete a short survey. And we'll talk about this again at the end, but it is going to have you fill out a short survey to help us inform future engagement sessions. So that is going to go over what do you all want from us at DHS here to engage with you on the second draft, time of day, time of week, format, etc. So look for that at the end. Next slide, please. All right, so jumping into it, if you are unfamiliar with the Child Care Regulation Modernization umbrella term, it is actually quite a large project that consists of more than just the revised licensing standards that I'm sure many of you have heard of. We have 3 components and 2 service classes that this project applies to. So first, you can see here that it applies to family childcare, which is what we're going to be talking about today, and child care centers. On top of that, each service type has three components that are the same. The risk-based tiered violation system, which is also known as the weighted risk system, the key indicator system for abbreviated inspections, which we say abbreviated inspections for short, and the revised licensing standards, which we'll be talking about today. If you are interested in those other two components of the project, I encourage you to go to our project website and dive into more about what those consist of. Next slide, please. So why are we looking at the revised licensing standards? Well, it all started with the Family Child Care Task Force. They made a recommendation to modernize and update licensing standards for family child care in Rule 2, otherwise formally known as Rule 9502, and statutes, which is primarily 245A. In addition to that, the Minnesota legislature directed DHS to work with the National Association for Regulatory Administration, short for, we call it NARA for short, to develop revised licensing standards, which one, are grounded in national regulatory best practices, and two, must protect the health and safety of children, be child-centered, family-friendly, and fair to providers. Now, as you can imagine, those directives kind of have a natural tug and pull with one another. And so that is why we go through this drafting process with all of you. And it's kind of like a big team collaboration to get to the goal of balancing those two directives. And we right now are in the second step. Next slide, please. So with that, you can see here, we are in that green highlighted half circle. We are currently on the second draft step. Previously, we shared a first draft in April of 2024. We gathered a ton of feedback from everyone last summer. We created the second draft. We'll then gather another set of round of feedback from all of you, and then create a third draft, which will be published prior to the 2026 legislative session. So this second draft is not final language, not yet. It is a working document really designed to reflect all of your feedback from last summer. And we are going to engage all of you, community members, parents, and other interested parties to read the draft, share your concerns, share your feedback, all of us this round as well. Next slide, please. All right, so that kind of leads us into where we are and what we've shared with you right now. So we're going to talk about the supplemental materials now. And that first supplemental material I'm going to talk about is the revision document. And this is posted on our project website. You can find it under the news and updates part. We kind of updated our website a little bit. So instead of scrolling all the way down to the Get Involved tab, which we've normally that's where we share everything. We created kind of up closer to the top of the web page, a news and updates, and all of this can be found there as well. So this revisions document is an annotated draft of every change made between draft 1 and draft 2. So what does that mean? Well, within this draft, within this document, you can see red strike through lines, which indicate that language has been deleted. So it used to live in draft 1, but no longer lives in draft 2. If it's blue and underlined, it indicates that new language has been added. So it wasn't in draft 1, but now is in draft 2. And then we will see green, either double strike through or double underline. And that indicates that that language was either moved from one section to another. So if you're reading through a section in this revisions document and you see the double strike through green, that means that it used to live there in draft 1, but got moved somewhere else in draft 2. And if you see the double underline in green, it means this is where it lives in draft 2, but it used to live somewhere else in draft 1. So it's not new language, but it is moved language. Next slide, please. We also shared a significant changes summary. This is a high-level overview of the significant changes made between draft 1 and draft 2. It does not outline every single change. That is what the revisions document that I just went over does. And we do try to organize it by topic within there. We will, today, we'll be using that document kind of as an outline of what I'm going to dive deeper into the significant changes. Next slide. All right, so significant changes. Just a little bit of an overview of the document as a whole. We did reorder most of the sections in the family child care draft. So for example, in draft 1, caregiver qualifications used to live in 245J.06, but in draft 2, it now is 245J.08. However, there were some sections that remain the same, like definitions, for example. That is still the very first section within the draft, 245J.01. We did this to hopefully just better organize it and have like a better flow within the draft from topic to topic. We also consolidated a few sections. For example, in the first draft, we had health and safety requirements, which was 245J.21, and health policies, which was 245J.23. In the second draft, we combined those two sections and created health policies and safety requirements, which is now in the second draft 245J.19. So you'll be able to see some of those subtle differences as you work your way through the draft. We did the same thing for infant and safe sleep and crib safety. So because we did this consolidation, we moved from 25 sections in the first draft to 22 sections in the second draft. We also did some tweaking on names due to either combining some sections or just trying to streamline like the names and make them shorter. So for example, in the first draft, we had physical environment and space requirements. That's pretty lengthy. So in the second draft, we're just calling it physical space requirements to shorten it. And then lastly, as you can see in the revisions document, we eliminated language, moved language, added language in, so there will also be those changes as well. Next slide, please. All right, I'm going to take a sip of water and then we're going to move into the significant changes. Next slide.
And Catherine, this is Brandon again. I don't know if Daniel is with us, so just an FYI, we're all
Awesome.
good to go.
Perfect. Thank you. Right, first topic we're going to cover is licensed capacity and child and adult ratios. In the second draft, we introduce a new license class that we are calling B3. This B3 license class will allow a capacity of 10 children with 2 adults, allows 10 children under school age, no more than 6 children may be infants and toddlers, and no more than 4 may be infants. We did introduce this new license class. However, we are going to eliminate the license class D, which allowed a capacity of 9 children with 2 adults, no more than 7 under school age with no more than 4 infants. Hopefully this will allow more kiddos under school age, which we heard from all of you is very important last summer, and allow you to reach some of those younger kids. We also made updates to the license class C3. We increased it to 18 children with 2 adults and allows for 10 children under school age. No more than 5 children may be infants and toddlers, and no more than 3 may be infants. What this used to say was a capacity of 14 children, so we increased it by 4 spots with 2 adults, and allowed 10 children under school age with a limit of 4 infants and toddlers and no more than 3 infants. Next slide, please. With that additional capacity and ratio expansion, we are also adding some additional licensing requirements. So the license holder must meet certain criteria to ensure the health and safety of children with the expansion of these license classes. So this criteria includes looking at compliance history as well as at least 4 additional hours of annual training in behavior guidance, child development, and active supervision. Next slide, please. Moving to caregiver qualifications, we are essentially in this section recognizing a second adult caregiver's experience, and we wanted to make sure that their experience as a second adult giver works towards their advancement in their career. And so we just inserted them in it. Didn't really change the language, but did change the inclusion of a second adult caregiver. Next slide, please. Training requirements. In the first draft, we had language that stated an individual shall not use a specific training or class to meet minimum training requirements more than one time every 5 years. We got a lot of feedback on this specific requirement. And in the second draft, we ultimately removed this requirement based on providers' feedback who expressed that repeating certain trainings might be really relevant to them, especially if they get a kiddo in their program that this training would really apply to that they didn't have before, and they just want that refresher. In addition to that, we also heard from trainers that they often update their content more frequently than every 5 years. So making repeated attendance actually more beneficial for providers than originally thought. Next slide, please. Behavior guidance. We had a couple things in this section. The first one was remove persistent unacceptable behavior and the language surrounding that, and ultimately shifting it to just general behavior management strategies throughout. We also took a look at separation times, or other more commonly known as timeouts, and established clear expectation for those tailored to the child's age or development level, and then we explicitly prohibit the use for children under the age of 3. We also looked at documentation requirements, and one, we removed persistent unacceptable behavior, so any documentation that came along with that was also removed. And hopefully, we also looked at separation times and then simplifying expectations for providers. So hopefully that also aims to reduce administrative burden within that section. Next slide, please. Physical space requirements. We did a lot here, so I've got a couple slides on this specifically. Let's start with outdoor fencing. In the first draft, we had language in there that specified using a continuous fence or natural barrier around the licensed play area that was required. In the second draft, we altered this language to allow programs without a fenced outdoor play space to create and implement a supervision and safety plan. So ultimately, this gives more flexibility to providers that do not want to put a fence on their property, or maybe it's cost prohibitive. We heard a lot too. So this just gives an alternate route to use for that requirement. We also prohibit children's access to electrical fences and made that clear in the language as well. Indoor temperature and humidity, we looked at, in the first draft, we had indoor temperature had a minimum of 68 with a maximum of 92, with also some humidity controls in there. In the second draft, we took all that out and realigned it back to what the current regulations say about this, which is at least 62 degrees Fahrenheit and no humidity requirements. And that was really based on a lot of your feedback from last summer. Next slide, please. Looking at fall zones, in the first draft, we stated outdoor play equipment designed for climbing, swinging, balancing, and sliding required specific materials and depths for protective surfacing. So if you recall, that's that, mulch, pea gravel, sand, etc. That language was in there in the first draft. And in the second draft, all of that was removed, mostly in response to significant cost concerns raised by all of providers and other community members. Scents and fragrances. In the first draft, we had a lot of language around what products can and cannot be used, such as aerosol sprays, incense, mothballs, chemical air fresheners. All of that was essentially prohibited in the first draft. And in the second draft, that was eliminated due to concerns from all of you on needing those scented products to eliminate some negative odors from having a childcare program in your home. Next slide, please. Lastly, within this section, we looked at covering of bare soil. We had some language in there in the first draft that stated that if there was any bare soil around the child care program in which the child would have access to, was required to either be covered or tested for lead. So what we mean by covered was, plant some grass, plant a shrub, plant, something like that. In the second draft, we removed that language due to the complexity, time, and cost it would take to properly test the soil around programs, and ultimately just isn't something we can do at this time. Next slide, please. Cleaning, sanitizing, and disinfecting. We re-looked at this section and did a lot of reorganizing and simplifying. So hopefully the content is clearer. We eliminated excessive documentation and ultimately are allowing providers more discretion in product usage. It does replace the detailed cleaning schedules and chemical specifications with a focus on maintaining cleanliness and addressing visible or known contamination. And then hopefully gives clear guidance on what to do around diapering procedures, hand washing protocols, and water temperature safety. Really just taking the section and instead of the sections being organized by like sanitizing, cleaning, disinfecting, it's now organized by places in your program and what you need to do around them. So hopefully that makes it more clear on what is being required. Next slide, please. Activities and equipment. We had a lot of really great conversation last summer about this, and in the first draft, we provided detailed lists on what equipment is required for each age group, meaning for infants, we want gross motor equipment and then gave a list of what that could look like. In the second draft, we eliminated those details and now just have the categories. So it will just say for toddlers, gross motor equipment, fine motor equipment, art supplies, etc. Instead of having, under art supplies, scissors, glue, etc. We do want to note that while this does allow for more program autonomy and individuality, which is really great, it does leave room for interpretation and monitoring differences. So we are still very interested in hearing from all of you if this is the right balance and meets the needs that we need to meet. Next slide, please. Health policies and safety requirements. Two big things happened in this section. We looked at pets. In the first draft, language was put in there. All areas accessible to children are free of animal excrement, animal hair, or feathers, and kept free of offensive or unpleasant animal odors, including urine and litter box odors. In the second draft, it now states all areas accessible to children are free of animal waste, including litter boxes and their contents. So hopefully clarifying the intent of that in the second draft. We also aim to clarify pet requirements by broadening the scope to include all pets at the licensed program, not just those that are indoors. Then we looked at pests. In the first draft, there was a lot of requirements around pest control documentation, and we re-looked at that and simplified it by removing the need to document pest removal steps and notify parents about pesticide use. Next slide, please. children with special healthcare needs or disabilities. We eliminated the requirement to create, coordinate, train on, and annually update an individual childcare plan for children with special needs or disabilities. Reducing the administrative burdens for providers. We heard a lot of concerns around this, so that has been eliminated. Next slide, please. Moving to environmental health, a few things were done in this section. First, and you heard me mention this in the physical space requirements section, the removal of testing for lead in soil. That was ultimately removed. Again, cost, complexity, and all of that, just too much at this time. We also looked at the water supply. And in the first draft, we had more robust testing for water, such as testing for lead, manganese, and nitrates in all programs. This included both municipal public water and private well usage. In the second draft, we realigned it closer to what we currently know for these regulations, which was testing for private well water only and not municipal. Next slide, please. Lastly, we re-looked at our radon testing requirement language, and ultimately it is retained, however, it is simplified. So in the first draft, for example, testing needed to be completed prior to initial licensure, and now in the second draft, the requirement has been changed to within 2 years of initial licensure or within 2 years of the effective date of this section and every 5 years thereafter. There is a grandfathering in period, which I believe is 5 years. And we do recognize that there's a lot to learn yet and discuss with radon testing and mitigation. So we are continuing to work with our partners at Minnesota Department of Health to provide information about radon testing and mitigation during this next round of engagement. So with that, I am going to turn things over to Daniel to go a little bit more in depth on radon.
Hi, Catherine. Can you hear me and see me?
I can hear you and see you, yes.
Okay, I'll share my slides. Are you able to see the full slides?
Yep, I can see them.
I could see him.
Okay, great. I'll get started then. Thank you. I'm Dan Tranter. I work at the Minnesota Department of Health and here to provide some information about radon, how you test and how you reduce radon. We do have more information on our website, mn.gov/radon. On the left side, you'll see a menu, a web page called Radon and Child Care. So just what is radon? It's a gas that's a type of radiation. It's naturally present in our soil. We naturally have a lot of uranium in our soil in Minnesota, and that breaks down and becomes this gas called radon. It's a type of radiation and a gas that's colorless, odorless, and tasteless. It floats around through the soil, comes to the top of the soil, and can get sucked up into our homes and other buildings. Unfortunately, here in Minnesota, we have some of the highest radon levels in the country. And while it is present outdoors, the levels outdoors are quite low. However, indoors, it can be built up to high concentrations. The good news is we can test our homes and other buildings, and we can reduce radon if it tests high. Lung cancer is by far the leading cause of cancer death in the United States. And while smoking is the leading cause of lung cancer, the second leading cause overall is radon. And for people who've never smoked, radon is the leading cause of lung cancer. US EPA has estimated about 21,000 lung cancer deaths per year in the United States are caused from radon exposure. And children may be more vulnerable. Children bring in more air into their lungs than adults do per pound of body weight. They have different lung shapes and sizes. So these factors may make children more vulnerable to the effects of radon. So outdoors, as I mentioned, a little bit of radon can be detected. On average, outdoors is about 0.4, and we measure radon in units called picocuries per liter. A liter is about a quart of air. So the units of radiation are called picocurie or PCI. The average US indoor level is about 1.3. The average Minnesota indoor level is about 4.0. And we have an action level that was adopted in the late 80s by the US EPA, and that action level is 4, meaning if you're higher than 4, we should fix that building, that home. And our average sits right at 4, and about 2 in 5 homes in Minnesota do test above that action level. We conducted a study about 10, 11 years ago. Maybe some of you participated in this project. We offered free radon testing, and 465 licensed in-home family child care participated and tested their home for radon. And these were homes in the metro and all across the state. And what we found was the range was anywhere from 0.3 to as high as 39. And remember that action level I mentioned earlier is 4.0. And almost half the homes tested above the action level. So similar to the general housing stock, perhaps slightly higher than the general housing stock for Minnesota. Now, while radon is a concern and it's a lung carcinogen, the good news is we have accurate, reliable testing methods. We can do short-term tests for a few days. We can do long-term tests for 3 months or longer. So the first row of test kits you see in this slide are do-it-yourself short-term test kits. And the second row are the do-it-yourself long-term test kits. And so we typically recommend when testing a family child care in a home, you start with a short-term test. You place that in your home for a few days. If it does come back at or above 4, you could proceed directly to fixing the house, but we would recommend a follow-up test to verify the first test was in fact high. And when you do that second test, it could be another DIY short test. It could be a long test you do for 3 months, or you could bring in a professional. A professional can see if levels are actually high during the day when the kids are present, or if it's high overnight, because they have these digital monitors that measure hourly or more frequent levels. So homeowners, home renters can obtain test kits and follow the instructions and standards to do testing. You can go online to mn.radon.com. You can sometimes find them at local health departments, hardware stores, and again, you can hire a licensed pro. Now, I know some family child care operate out of non-residential commercial buildings. Those buildings are different in that they can have multiple foundations, more rooms, they can have HVAC systems, ventilation systems, and other features that make them different than single family homes. So the testing is a little more complicated, and a licensed professional should test those types of buildings. So if the radon level is at or above 4, we do recommend installing a radon mitigation system. There are licensed pros that can install this. It's typically a pipe that starts under the house that draws air out and vents it outside, and that reduces the radon in the home. There's a fan in line that runs continuously, so that pipe can be inside the house. It can be on the side of the house, as you see in the smaller diagram. There are pressure gauges called manometers. There's an alarm that will go off if the system stops working, called an active notification monitor. There's labeling that goes on the system as well. So that in a nutshell is radon and how we recommend testing family child care in single family homes. And we do have some resources on our website. You can check your local health department to find if they have any low cost or free test kits. You can also buy them on mn.radon.com. There are some limited financial assistance resources out there. Typically, they're loans. And we do maintain lists of licensed measurement pros if you choose to hire a licensed measurement pro. And also the people who fix the houses, they're called mitigation pros. They're on our website. If you have a system installed, we can come out and inspect it for free to make sure it's installed properly. And also we have a free continuing education class. Again, if you go to our website, you'll find the link there. We can teach the class in person. There's also an on-demand class you can find online, which you can watch from your computer. And that is the end of my presentation. I'll send it back to Brendan and Catherine.
Awesome. Thank you, Daniel. I'm just gonna give us 1 minute to see if there's any specific radon mitigation questions.
This is Brandon here. I do see one from Shannon. Will the radon mitigation system be required if they have higher levels?
I can answer that, or do you want to go ahead, Brendan?
Go ahead, Daniel.
I'm just going to say, yeah, the latest draft 2 would require mitigation.
All right, Daniel, could you maybe repeat that? I don't know if it was just me, but the audio broke up a little bit for me when you were answering.
Oh, yeah. My understanding is the draft 2 for family child care requires mitigation if the radon is elevated.
Yes.
Yes, that is correct.
And then we
Thank you,
have
Allie.
another question. If you have a radon mitigation system in place, will there be a form to not test? I believe the you would still have to test every 5 years as it is written now, and that is due to ensuring that your mitigation system is still working properly. Is that correct, Daniel?
Yeah, the standard I believe is written would require testing every 5 years, and that's a good idea because radon levels can change. The system may stop working or something else might change in the building that could affect the radon levels in the home. So it's a good idea to test periodically to make sure radon levels are down, and I think it's good that it's in the standards to require in those cases too.
Thank you. The next question we have is there a specific time of year to test? I heard winter is best time to test.
You can test any time of the year, and I believe the standard is written doesn't say when you need to test. I think draft 1 had a specific time frame, but in draft 2 we changed it to say you could test any time of the year as long as you follow the instructions. If you choose to do long-term testing, you would need to include half of the heating season. But if you choose to do short-term testing, you could test any time of the year. As far as your other comment, yeah, winter can have higher radon levels. So it is a good idea to, if you do test in the summer, consider testing in the winter as well, but the standards as drafted would not require you to test in the winter, again, unless you're doing a long-term test. The standards do say half the time period would need to, but again, if you do short-term testing, you could do that any time of year.
Thank you.
Is it required
Is
to
it
be long or short? Oh, sorry, I interrupted.
no? Go for it.
Either testing option is acceptable. So we typically recommend you start with short term, but if you want to go straight to long term testing, you could do that.
Right, I'm not seeing any other questions pop up, so I am going to, oh, wait. Will there be any grants available to help cover the cost? I can take that one. Our team is exploring that right now. We understand that the cost is one of the biggest concerns. And so we're looking into that and we're trying to come up with a plan one way or another. So we're still interested in hearing from all of you on that. Any ideas, any comments, any feedback? But yeah, stay tuned for more on that. What is the average cost?
For mitigation, I assume is the question. In a single family home, typically the cost to have a professional install a radon mitigation system is from about $1,500 to $3,000.
All right, so I am going to keep things moving along. Brandon, if you want to pull up the next set of slides.
I will get working on that. There is one more question that came in. If either you or Danny want to address that, but I'm going to move us into our next slides too.
We have radon system. Do we need to have a test update? So on hand for licensing. So if this language were to be passed by the legislature in the 2026 legislative session, as it is written right now, there should be like a grandfathering in period where if you tested within the last 5 years of whenever that effective date is, you don't have to test again until the 5 years is up. So we would recognize previous testing within a certain time period. Hopefully that answers the question. If this passes, how long do we have to test initially? Is it 2 or 5 years? So initially it's 2 years or 2 years after it passes, or 2 years after initial licensure. But then after that 2 years, then it's every 5 years after that. All right, let's move on to our next steps and what we can look forward to. So, and thank you so much, Daniel, for joining us this afternoon. The draft standards was released earlier this month, and we are starting to collect feedback on the second draft, and we'll continue to do so through June of 2025. After that, we are going to take all of that feedback, analyze it, and then incorporate it into what we're going to call the third draft of revised licensing standards. From there, that third draft will be shared publicly again prior to the 2026 legislative session, which starts in February, and then also propose the third draft to the legislature. This is where I have kind of a big caveat that the process does not end after we propose it to the legislature. It will follow the legislative process, meaning it will be heard by all of your representatives and your senators. And so staying engaged in the process as it goes through the legislature is still very important. And so don't forget about that step. After it goes through the legislature, we then will take legislative action and work on implementation. That is the details of that has yet to be decided because there's still so much time between then and now. But we do want to recognize that we see this as a big change of whatever does pass. And so we want to be very deliberate with our approach and make sure that guidance and training is given not just to our providers, but to our licensors, and knowledge is widely spread to all of our community members as well before this change is implemented. That may mean training, it may mean guidance, but we do recognize that that implementation portion will take some time as well. I also want to recognize on this slide that on that June 2025 date is when our project team, so the Regulation Modernization team, is going to be moving over to DCYF, that's the Department of Children, Youth, and Families. And so this project will no longer live under the Department of Human Services, but live under the Department of Children, Youth, and Families after June of 2025. Next slide, please. So engagement opportunities. You may have seen in our email announcement and on our project website that we are right now collecting provider association interest forms. If you are a part of a provider association or group, big or small, but you meet regularly and you've got a group of providers, please feel free to fill out that interest form. We're interested in meeting with you as best as we can. We do want to recognize that our team is small but mighty, but we may have some capacity issues, but it does give us a sense of who's out there who wants to meet with us, and we will do our best to reach everyone through that one means of engagement. In addition to that, we are currently working on developing a parent survey to solicit their input on what is most important to them in a child care licensing environment. And so look for that, more details to come. And then again, I want to mention that the post-session survey is going to come on after this, after we end this afternoon, and that'll really help us plan out more provider engagement opportunities and more with all of you through March and through June of this year. So again, that's going, oh, Brandon, if you want to move to the next slide, we've got a little snippet of what that looks like. So it's going to first ask you how we did in this webinar, but then also give you some options of what time of day works best for you, what time of the week works best for you. Should it be virtual, in person, hybrid? All these different things that our team tries to consider, and hearing directly from all of you will only help us create opportunities that will work for all of you as best as we can. All right. Next slide. And with that, I can't believe it, but we have time, we have a good amount of time for questions. Oh, feel free to stay on for questions, or if you have to run after some kiddos, go for it. But thank you so much for joining us today if you have to run. Can you please address changes to the age category definition, specifically toddler, as they relate to each license class? Yes. I think as it is written now, I believe the interpretation would be that they would apply to the B and C license classes. However, I know we've gotten some emails in our team inbox on this, and so we are still open up to feedback on the definition and what all of you are thinking on it. That's what I can say. Is there Carrie, is there a specific question about the definition that you are referring to?
Catherine, I'm not sure if she can. I'm not sure if Carrie can submit, unless she submits another question. So Carrie, if you want to submit another question to clarify more specifically what you were asking. I also see Michelle had a question. Why did they change the age specifically for toddlers? So I don't know if that's related.
I think that might be related, and I think for right now, I want to take those questions back and relook at it and kind of refresh my brain of kind of how we got there. Because I don't want to misspeak right now and give incorrect information. But thank you for those questions, and I will for sure take those back.
Okay, great. There's another question for the increased training for the C3 license. Is that 4 hours in all areas listed, or 4 hours in any or combination of the areas listed?
As it is written right now, I believe it's 4 hours total. For our feedback for the new draft, who do we write to? So you can write to our team, Brandon, Angela, and myself. The project email we will share at the end is ccregmodernization.dhs@state.mn.us. I know it's long, but we'll put it up on the screen for you at the end. Or if someone can reply to April with that, that would be great as well. You can write to us right now if you would like, but otherwise, we also will have future engagement opportunities for you to provide in-depth feedback on topics and different sections of the draft. So stay tuned. Otherwise, you can email us right now. Regarding children with disabilities, considering non-discrimination rules, etc., I wonder if you can provide language to assist with situations where a child's needs are not actually being met in the setting available. Is such language necessary to help us navigate those delicate situations? Does my question make sense? Yes, I believe it does make sense, and I think we'll definitely take that back and discuss it some more. So thank you so much for sharing that with us. Lydia, so if I test my home for radon, if it's above average, what happens then? So if by above average you mean above the 4.0 liters per, I don't know the exact.
Picocuries per liter.
Yes. Yes, if it's above that 4.0, then you would then want to get a mitigation system put in. If it's below the 4.0, like let's just say it's like 3.8, then per the requirement, you would not be required to put in a mitigation system.
And I would just add that, I believe the draft says they have 120 days to install a mitigation system.
Yes, start that process with a professional. Any other questions? This is always the awkward silence in in the virtual sessions.
Catherine,
Yes.
can you hear me? I was going to put our email into the chat here, but I'm not able to do so. So just as an FYI, like we will get that information to you.
Yes. Okay. Thanks, Angela. I think Brandon or someone was able to put
Yes,
in.
I was
Okay.
able to put it in there, so it should be in there.
Great. Thanks, Brandon.
Yeah, no problem. Oh, I also see Teresa's question. I missed the beginning. Is there a way to get the slides? Yes, we will. We will post the slides and the recording on the project website once they're made accessible. And specifically, you know, yeah, we'll post that, make it accessible, and yeah, so just keep an eye out for that. And you can always you know, email our project inbox too, if there is something you missed or you have a question about some of the content covered today.
If you don't use your basement for daycare, will you have to test regardless? Daniel, do you want to take that question?
Yeah, my understanding is what we proposed for draft 2 is you test the lowest level used for childcare. So you would test the basement if it's used for childcare. If you don't use the basement for childcare, you test the main level if that's where you have your childcare.
Yes, that's my understanding as well, without
And
having
just-
the exact
Yeah.
language.
And just to add to that, it's not just basements that can be high. We could see high radon on the main level too. So, yeah, it's important to test to protect the kids.
Judy has a question. She's curious why all homeowners don't need to test for radon.
Yeah, that's an interesting sort of question about what is the scope of government and should the legislature pass such a requirement. It's the legislature's prerogative to decide if, you know, a law should be enacted. There is no law anywhere in the country that I know of that requires, you know, all homeowners to test. There are some states that require childcare to test. There's some states that require schools to test. There's states that require rental properties to test. I've seen one county that requires it during home sales. So there's different laws in different parts of the country, but I've never seen one that just says everyone in any home has to test.
Awesome, thanks, Daniel.
Seeing a question from Renee. Sorry if I pronounced that right. We do have an evening session coming up later this week. And I want to make sure I get it right here. I believe it's on Wednesday this week. Yes, it's on Wednesday this week at 6 p.m. And also this session is being recorded, and as I shared, we also are planning to post a recording. So for those who aren't able to make it to this session, they'd be able to watch the recording as well. Thank you.
Thanks, thanks, Brandon. And more for going even further than the info sessions, yes, we would plan evening as well through June. But it also is really great to hear all of you in that post-session survey that we have, which will help us get a sense of who wants evening, what works, you know, good for afternoons or time of the week, etc. So definitely are trying to take people's availability as best as we can through all of our engagement.
And yeah, it really is a very short survey, and it should pop up on your screen as soon as this webinar ends. So I would encourage you to just, you know, fill it out right then, get it, you know, check it off your to-do list if you have time to do so, and that'll really help us inform what we're planning for this next round of engagement.
on for another minute or two. See if we get any more questions. All right. I don't, oh,
Like we got a nice comment from Becky. Thanks for that. And Katie, my question was not answered.
yes. Katie, I see your question up above. I am going to relook at the language just to refresh myself exactly how it is worded. Feel free to email us and we can help clarify that if we can. Yeah, I don't want to misspeak here without refreshing myself exactly how the language is written. Oh, Katie's question was my understanding correctly on additional group family childcare requirements that to be a group family childcare applicant, you essentially need a certification or licensure indicating a CDA, a bachelor's degree, or elementary ed degree. And I just want to refresh myself because it's been a hot minute since I looked at that language. Are providers required to retest after the mitigation system is put in? Is it common for those systems not to lower the levels?
Yeah, so the standard requires testing after the mitigation system is installed. And I believe the draft 2 says you need to do a follow-up test after mitigation to verify radon's been reduced. It's not common that radon wouldn't be reduced. Typically, the first time they put the system in, it's going to reduce radon to under 4. In rare cases, they may need to come back and do some additional work to get the radon level under 4.
And then for the requirement, even if you do have a mitigation system, how the language is written right now is that you would still test at least once every 5 years to make sure that mitigation system is still working.
Correct. And the house can change. Maybe you've done work on your heating and cooling system. Maybe you've excavated the soil. Maybe the radon system is no longer working effectively. So things can change over time. So as we talked about earlier, it's a good idea to check periodically. So 5 years is what's proposed.
All right. With that, I think we will give everyone some time back this afternoon on a beautiful Monday afternoon. Hopefully you can get outside and enjoy some of that spring-ish weather, or at least it feels like it to me. Thank you all so much for your time this afternoon. If you do think of a question that you wish you had asked during this information session, feel free to email us. Again, Brandon, Angela, and myself all do monitor the project inbox. And so we will see it. It may take us a minute to respond, but we definitely will respond to you and get back to you. Have a good rest of your Monday, everyone. And don't forget the post-session survey. Your feedback is very critical to us in our planning. Thank you.
Thanks, everyone. Going to end the webinar now, and please take the survey. Have a good one.